Right. My name is Jacqueline Dorsey, and I'm in your speech class. We met like the first week of school, and I'm really enjoying your class. You don't give us much work, and that's good. My assignment here is demonstrating stare technique. I am a surgical technologist, and I work for Andalusia Regional Hospital. I've been there around 9 years or so. I love my job. I love helping people. My career started about 17 years ago out in Las Vegas, Nevada. I went to school there for a surgical tech, graduated in the mid-'80s, and worked there for several years and decided on being a traveling tech. That's one good part of this job, is being able to travel. You can make a lot of money, you can meet people, and you can see the world. My first assignment was in Washington, D.C. area. I had never been on the East Coast, so it was a new experience for me. I stayed there a couple of years and decided to move home, which is Andalusia. So I've been here about 9 years, but a year ago I decided to take a break from here, and I moved to Atlanta, where my daughter is. It was an experience. I actually learned how to scrub hearts. So that's just one more avenue under my belt, but my specialty here is orthopedic. So if you just kind of follow along with me, I'm going to demonstrate stare technique. My main job as a surgical tech is setting up and maintaining a sterile environment. Our first goal is, to prevent infection. There's a lot of people that come in the hospital with infections, but we definitely don't want them to come in with one and leave with one. So that's mainly what I'm doing, is trying to keep a sterile environment. So I'm going to show you this gown here. This is the gown we put on. It's sterile, and so this is to not only to protect us from the patient, but it also protects the patient from us. So we open this up in a sterile manner. We put it on. You can put it on any kind of top, because the inside is what's sterile, not the outside. So we open it up. We then open up our sterile gown. You have to have a gown. I remember probably in the 1800s or so, gloves were not even invented. So, they did this stuff with their bare hands, and my God, today that just would be unheard of. So we open up the gown, on the glove on the sterile field. Glove. First thing we do is I have to go outside and scrub at a scrub sink. As you know, there's no way for me to be sterile, but my main goal is to be as clean as possible. So we go out and we scrub our hands. We come back in the room, our hands are wet, and they're not supposed to drop below our waist. The only thing that's supposed to be sterile is from our waist up. Even the back of us, even when we put on that gown, is not sterile. Your back is never sterile. So my hands are wet. First thing I have to do is grab this towel, dry your hands off. Dry one finger at a time. Come up your arm. Make sure it's dry. Try to prevent this piece of paper from touching your clothes, because you're still unsterile. So still got to dry each finger as dry as possible, because if your hands are not dry, it's very hard to get your gloves on. So you dry yourself off. Throw the paper away. Come over, pick up your gown, put your gown on. As I put my gown on, the RN in the room is called a circulator. She's the one that whatever I may need or the surgeon may need, she runs out of the room and get it for us. So she comes up behind me and ties me up. I'm going to show you two gloving techniques. This is the closed glove technique, okay? First thing you have to do, you have to open your glove, open the paper, I'm going to do my right hand first. This is just something they teach you. You put your right hand on first. You lay it right on the palm of your hand. Open up the first cuff here and just swing it over your hand. From here, you just pull your gown up. Your cuff should always be inside of the glove. There's times when your glove might roll down, your cuff comes up. That's a big no-no. Doctors will make you break scrub and redo it again because your cuff is unsterile because it's over your fingers. The next one we do is our left hand. What I'm going to do is put my hand right under the cuff here, still with my fingers on the inside of my cuff, okay? Because my fingers are unsterile. They're clean, but they're unsterile. So, flip it around, put your hands in, pull up your sleeve. Cuffs are still on the inside. Right now, I'm considered to be sterile. This gown is blue, as you see. The paper here is blue. The table covers, all the sheets and everything in the room is blue, and that means sterile. That way, anyone that's unsterile that's in the room know not to touch these areas. I've just demonstrated the closed glove technique. Now I'm going to show you how to open gloves. Now this situation might happen maybe in the ER where a patient comes in and maybe have cut themselves and the ER doctor sews them up. Now in the ER they're not going to gown and glove, okay? It's just not like the operating room where it's a sterile environment, but you still would like to have a sterile glove on. So I'm going to take this off, lay it over here. Going to open up some sterile gloves. Going to lay them on any type of surface because the inside is what's sterile. Okay, this is called an open glove technique. You're going to take your unsterile hand here and just open up the inside of this cuff. Because the inside here is going to be against your skin, so you can touch here. Okay, so we're going to put our hand in, pull the glove up. We're going to take our right hand and put it under the cuff of this left glove. Pick it up, put our hands inside, pull it up. Then with the sterile hand, we're going to lift under here and finish pulling up this side. Now my hands are sterile. I'm free to help the ER doctor, anyone. I might be doing an IV, anything that I want to create some type of sterile environment, and now my hands are sterile. I hope y'all enjoyed this. I tried to teach you everything I know. Thank you so much. Happy Thanksgiving. Bye-bye.